Okay, hormonal health 101. Today we are going to talk a little bit about sex hormone, where they come from, and what do they do in female and male body. What are the signs of deficiency, and what can we do from herbal, nutritional, and kind of health behavior side to improve all of that. So the sex hormones, there are male sex hormones that we are calling testosterone, dihydrotestosterone, probably DHEA and DHEAS can be part of that too, and androstenedione. The female hormones that we call estrogen, estradiol, and estriol. And estradiol comes usually from ovaries. Estrogen frequently comes from peripheral conversion of estradiol or testosterone in the fat tissue, and estriol usually comes from uterus from placenta, helps the pregnancy going, and it's actually one of the best estrogens to have on board. So it could be very good hormone replacement therapy type of estrogen. And we have progesterone. Progesterone, believe it or not, is pro-hormone to all of them. And there is a steroid cascade, which I didn't put here because it's very complex, where everything starts with cholesterol. And cholesterol then turns into progesterone, then turns into pregnenolone, and they all are starting to turn into different things, including cortisol, testosterone, and estrogens. So where do they come from? The adrenals produce small amount of all three versions, and testicles will produce a lot more of testosterone. Ovaries is estradiol and progesterone, and placenta estriol and progesterone, and adipocytes will produce estrone. So we all know effects of testosterone on male body, but there is very similar effect of testosterone on female body. So it does help with bone density, muscle strength, and increased endurance, hair growth, and collagen growth. That's why when we have patients who are, let's say, males, older males who don't have much of testosterone left, their skin becomes wrinkly, similar to estrogen in females and women, that skin becomes more wrinkly because estrogen as well as testosterone play an important role in collagen growth. Then we have effect on brain. Testosterone frequently helps with mood, confidence, memory, and increased sex drive, both for female and males. So that's where balance of testosterone and estrogen and progesterone becomes very, very important. Bone marrow. Men usually have significantly higher amount of red blood cells, and that's because testosterone helps production of red blood cells from bone marrow. And obviously we have all kinds of effects of testosterone on sex organs, and females and males both. So we have this dihydrotestosterone. So we don't hear much about that in the news because everybody more focused on testosterone. But what is it? It's actually when we have slightly modified testosterone biochemically, and it's actually responsible for a lot of, you could say, good or bad things, depends where you are talking to. Are you talking to men or are you talking to women? So for men, it will help with hirsutism or for facial hair, and for women, it will be called hirsutism when it will be too much of facial hair or body hair. For both sexes, it could be acne on the face, not fun, but that's when you have too much of it. As well as if you have too much in a scalp, it can cause baldness, and it will be male pattern baldness for men and female for women. For men as well, it can cause prostate enlargement, and because of that, we have several medications and herbs that help specifically to block production of dihydrotestosterone and help as a result to reduce that prostate enlargement. And if you have too little of dihydrotestosterone, it's not very good as well. Why? Because it can lead to ambiguous genitalia. So your baby boy will look like either like completely baby girl or something in between. And there is very good book about that called Middle Sex. If none of you have heard of that or listened to book on tape, I do definitely encourage you to read about that. And frequently men who weren't exposed to dihydrotestosterone in utero will have absent secondary sex characteristics, because it's interestingly that by default, everything will be female looking outside if you don't have this dihydrotestosterone, even though they still could have things on inside, like testicles may be present inside. So progesterone, as I said, it's a hormone that is kind of precursor of everything, but it does change throughout the female cycle, and it helps to stimulate production of or stabilize growth of inner lining of uterus, and it stimulates the endometrium to receive and nourish the implanted egg, fertilized eggs. But if that doesn't help, or if that doesn't occur, then progesterone level drops, and that's when people develop the periods. However, if pregnancy occurs, then progesterone is produced by placenta, and it's helps to sustain that pregnancy. So what's estrogen? And estrogen in female body is shown to protect against cholesterol issues. However, there is dual effects. There is increased HDL, happy cholesterol, but LDL can go up or down, depends. And triglycerides could go up with estrogen if there is any kind of genetic predisposition. And that's true not only for women's body, but for men's body too. Obviously, all the female body parts that require estrogens, like ovary and uterus and vaginal health, are super important, and may be important to replace if you don't have any contraindications, at least topically. For brain, as for testosterone in men, it helps to increase memory, adjust libido, and apparently we all know effects of estrogen on body temperature. When women become menopausal, frequently women start getting hot flashes. However, I would say that men get hot flashes too when they don't have enough of testosterone. When their level of testosterone drops, they may develop hot flashes similarly as women do. The breast growth is important and preparation for breastfeeding. And the skin makes, estrogen makes skin looking young and silky. The bone strength is important for women and actually for men too. We know that if we completely block estrogen in male body, they have tendency to develop more osteoporosis, thinning of the bone. So it's not accurate only for women's body, it's accurate for men's body too. So the estrogen throughout women's life changes. As a child, there will be minimal level coming only from adrenals, same as at age 70 and 80. And usually peak of estrogen will be around age 35. And then after that, the level of estrogen starts dropping down. And as we go through menopause, level can become lower and lower. Unless menopause was surgical, then that will drop dramatically right away. And that's, I hear, not very fun time for any women. So what are the symptoms of low estrogen? Irregular menstrual periods, mood swings, hot flashes, tenderness of breasts, headaches, and many of those symptoms will be very similar to the symptoms of too much of estrogen. So this is your symptoms of estrogen dominance. And Estrogen dominance could be actual high level of estrogen, or it could be a relatively high level compared to progesterone, because as we age, our progesterone level starts going down as well. And the ratio between estrogen and progesterone could change. I'm not familiar with any study that actually gives us those magical numbers, what the ratio should be between estrogen and progesterone, but clinically, those are the symptoms of estrogen dominance. And frequently, when I talk to my patients and ask about PMS symptoms, about uterine fibroids or breast cancer or breast fibrocystic breast disease and so on, that could be estrogen dominance. As well, it's interesting that average woman who goes into menopause during first year usually gains about 8 pounds. And frequently it will be around the abdomen, hips, and thighs. Unfortunately, it doesn't necessarily improve on its own unless woman actually tries to lose weight down the road. And what happens with high estrogen in men? It's actually some degree similar issues. There will be increased fat tissue, more in abdominal area. Because of higher estrogen, there usually will be less of testosterone. And with that, you will have erectile dysfunction and low libido, and lower muscle tone, and increased breast tissue. So it's kind of not fun for men to have that. Increased because of change in cholesterol and insulin resistance, there will be change in heart disease rates and strokes, enlarged prostate and increased chance of prostate cancer, and constant fatigue. So the estrogens, when they are cleared from our body, they go through different pathways. Pathway 2 is supposed to be a good estrogen. Pathway 4 and 16, you can see it's crossed out here. It's not very good estrogens. And those are the ones that are associated with high chance of getting breast cancer. So we actually can measure those and see which pathway your estrogen goes into. And what can we do about that? We need to support the genes that help you to process the estrogen into better pathway. Frequently, it will be with products called DIM, and it's diindole methane. Then you want to make sure you have good methylation pathway, because you can see there is part of there goes through methoxyestradiol and so on. And you want to have very good bowel movements, because part of the estrogen metabolism will be excretion through this stool. So if you have some kind of constipation, we definitely need to work on that. And that's true for both male and female body. So you can see here in with healthy microbiome, you have ovaries that produce estrogen, or it could be even fat tissue producing estrogen. All of that goes through liver and then gets through all of these CYP pathways, and then through the guts, and most estrogen exits the body. But some estrogen can go back to the body. In unhealthy microbiome, you have problem with beta-glucuronidase. And because of that, most of estrogen goes back to the body, and some estrogen exits the body. And that's where it's, as I said, super important to have regular bowel movements and not the constipation. So what do we do to support for low estrogen? Flax seeds, different soy products, walnuts, chickpeas, sesame seeds, those are all supporters of low estrogen. What do we do for high estrogen? We support methylation and provide you with methylfolate or methylcobalamin. Glucuronidation, that's through the GI tract. We need to make sure that your guts work well, and plus this DIM, which is diindolylmethane, it comes from broccoli, but to have enough of that for a day, you would actually have to eat 3 or 4 pounds. So frequently it's easy just to take as a supplement. Then resveratrol, citrus fruits, different vegetables and fruits in general. And maybe you can take actual deglutarate separately. And you can see here that soy, even though frequently it's for low estrogen, it could be helpful for high estrogen as well. Plus dandelion, and dandelion helps your liver to work better, and many other herbs that are listed here, including curcumin, which is actually comes from turmeric. And you know that the resveratrol comes from the technically from wine. So then there is another process called sulfation, and sulfation is from allium family. It's your onions, garlic, leeks, shallots, and chives, and cruciferous. They all are very good source of sulfur, and therefore they will be able to provide that sulfur to help to get rid of the estrogen. And another one which is important is glutathione. And we talked about glutathione being very, it's a master antioxidant that helps our liver to work better and get rid of a lot of chemicals, including extra estrogen. So the foods are rich in glutathione will be, you can see here, avocados and milk thistle, turmeric, okra, walnuts, spinach, and so on. One of the best ones as well is liver. So if anybody likes liver, that's actually very useful. And then we switch gears and talk about testosterone. So we want to lower testosterone in women who have too much of it. And then we'll talk about increasing testosterone for men who wants to increase it. Apparently, to lower testosterone, licorice root. Licorice root is one of the adaptogens that help our adrenals to work better, but it's men apparently can cause about 26% drop in testosterone level. The vegetable oil is not very good way to lower your testosterone because it's frequently rich in omega-6s and processed foods. So it's again, not that we all need to go do that, but nuts become very helpful way to reduce your testosterone. And in women with PCOS, where we have extra testosterone and testosterone precursors, walnuts and almonds apparently reduce or increase level of sex hormone binding globulin significantly, and that helps to reduce actual free testosterone. With dihydrotestosterone, that's the one which causes acne and the extra hair on the face and baldness and the prostate issues. The things that we can use is sopalmetto, serenoa repens, lycopene from tomatoes, zinc, avoidance sugar, and moderation of caffeine will be helpful. And if nothing works, then finasteride is available as a prescription. So how do we increase testosterone? Apparently, regular exercise and lifting weight helps. Losing weight, but not to the point of constant dieting. You have to have enough of protein, carbs, and fat to produce the testosterone. There was an interesting experiment when a group of volunteers decided to recreate experiment that was done in animals originally, where people, or originally animals, ate 30% less calories, and they lived for significantly longer lifetime. So like if your mice usually lives for a year total, here mice lived for a year and a half. So it was like 30 to 50% increase in longevity. So here a group of humans actually decided to do the same. and they ate 30% less compared to what their requirements needed. And they actually had a lot of good improvements in their health, like improvement in telomeres and reduction in inflammatory markers and pre-diabetes, diabetes, but their testosterone dropped and estrogen in women. So yes, we definitely want to have enough protein, carbs, and fat in our diets. Minimizing stress is very important because, as I mentioned before, there is this pathway where everything starts with cholesterol, then progesterone, pregnenolone, and then splits into creation of cortisol versus creation of testosterone and estrogen. And if you have too much stress, all the hormones will go toward creation of cortisol. As we talked last week about the cortisol, there is a stage where with high stress, constant stress, your body requires or creates a lot of cortisol. And that's where you can see cortisol still. And here, by minimizing stress, working on your mindfulness, you can start shifting that, and men will start creating more testosterone. So vitamin D, zinc, ashwagandha, those are important ones for the creation of testosterone. And for specifically sperm production, I've seen some studies where coenzyme Q10 and zinc were very important. And for some men, it's actually a good idea to try to be on gluten-free diet, because some undiagnosed celiac patients may not have problems with their gastrointestinal tract, but will present with infertility and low sperm count. And therefore, gluten-free diet could be very, very useful. Avoidance estrogen-like compounds, BPA and other things that come from plastic, they are estrogen, or they're endocrine disruptors. And because they are, we have to avoid them in order to preserve our testosterone in men. It's preferably to avoid them actually starting in utero, because otherwise, again, that can lead to developmental issues right from the start. So the regulation of testicular and ovarian function. We have CNS, hypothalamus, and pituitary that helps us to create GnRH and then LHFSH. And those two hormones go and stimulate different parts of ovaries or testes to produce enough of testosterone, sperm, or to help us with cycling. And that's the picture of actual cycle, of female cycle. And when we have first day of period, that's called day 1 of the cycle. Somewhere in the middle of cycle, we have the ovulation, and the egg lives for about 2 days. That's time of the opportunity for creating of the new life. And then you can see that after ovulation, your estrogen, progesterone level go up. And when there is clear signs that there is no pregnancy, then progesterone and estrogen start dropping down. And that is the sign for the uterine lining to start shedding. And that causes the period to start again. So that's a complex picture, but it's important to recognize that that's what happens in female body, and that's what it is. I think that's pretty much everything on this part. Let me stop sharing that. So we